Today we will discuss about the primary assessment of the adult. So what do you mean by primary assessment of the adult? So primary assessment, here firstly we have to introduce what is the introduction. जब भी कोई पेशेंट आता है किसी भी लाइफ थ्रेटनिंग कंडीशन में, तो रैपिडली जो हम सबसे पहले इनिशियल असेसमेंट प्राइमरी इनिशियल असेसमेंट होती है पेशेंट की ऑन द बेसिस ऑफ वेरियस क्राइटेरिया, दैट इज़ ABCD एंड ट्राई एज, उसे हम बोलते हैं प्राइमरी असेसमेंट. देन वी हैव टू डिफाइन द प्रोसीजर. सो व्हाट वी आर डूइंग, फर्स्ट ऑफ ऑल वी हैव टू असेस द environment, perform hand hygiene to prevent any infection, PPE kit or isolation precautions if needed. After that, we have to approach the patient to perform a primary assessment. It includes 5 components, that is A, B, C, D and E. A for airway, B for we have to check the breathing pattern, C for we have to check for the circulation, disability, and the last one is exposure and environmental control. Then A, we have to define what comes under the airway and alertness, and how we are going to assess this component, and what we have to do if there is any partial or complete obstruction in the airway of the patient. The second component is B, that is breathing and ventilation. So how in this paragraph we mentioned that how we are assess the patient for breathing pattern, and what we have to do if it comes abnormal or absent breathing pattern. Then there is a C for circulation. So if the circulation has been altered to some extent, we have to start the chest compression, position the patient, and defibrillation, and all these things we have to do. Then there is a disability, D for disability, that is neurogenic assessment we have to perform. It includes various aspects, that is eye opening, verbal response, motor response, best eye response, best brain stem reflex, and respiration, and we have to score the patient. So the last one is emergency triage, in which we have to categorize the patient according to the scoring. जो भी हमने assessment की है, उस assessment के basis पे हम